Millions of people across the country suffer from some form of hearing or balance disorder. Conditions such as hearing loss and dizziness are some of the most common complaints. And of this patient population, only a fraction are accurately diagnosed and receive proper treatment. Why? Most people don't realize there are many options, ranging from medications, microsurgery, or new technology hearing aids, which can help their condition.
For some reason, there's still a stigma to wearing a hearing aid. Unlike eyeglasses that are worn just for style, they just don't know what's available. They have had somebody that had a bad experience with a hearing aid 10 or 15 years ago when technology was in the analog form rather than in the computerized form. And a lot of people don't understand what's happened with microsurgical techniques. So you can improve both your hearing either from a medical standpoint with amplification or hearing aids, or from microsurgical procedures such as middle ear reconstruction or stapedectomies.
There is a combination of surgical and medical technique for this sudden hearing loss that is quite profound, and that is a tube is placed in with medicines instilled at the round window which goes right into the cochlea. And that has improved hearing in many individuals. It also has improved tinnitus in severe cases.
Creating the right treatment plans often requires the help of a doctor of audiology. Historically, ENT specialists and audiologists have worked closely together, but not as peers. But at this practice in Omaha, Nebraska, ENT specialists Dr. Gary and Iris Moore work hand in hand with their partner, audiologist Dr. Trish Morrow and her staff. This collaborative approach puts medical politics on the back burner and patient care at the forefront.
Dr. Morrow's expertise enhances what we do primarily from a hearing and a balance standpoint. The sophistication of the testing equipment that she has is able to allow us to pinpoint where the problem is within the patient's inner ear or central nervous system.
I had a patient come in with a previous diagnosis of hearing loss, which we did our own evaluations here and did confirm, yes, he did have a hearing loss. However, it was a conductive loss, which was actually caused by otosclerosis. And this is a condition that can be treated surgically rather than needing the use of a hearing aid. Our approach is let's investigate this further, look at the auditory system completely.
This field of medicine has evolved past the conventional hearing aid. Looking toward the future of care for this patient population, more people will discover that their care involves a highly trained team of neurotologists and audiologists who may, in fact, more accurately diagnose them, offering new and innovative treatment options.
The goal at Central Plains ENT is to improve our patients' life with compassion for their problems, sophisticated testing, and accurate medical and surgical treatment for their problem, whether it be hearing, balance, or other ENT abnormalities that they may have.
The advancements in technology have been dramatic in the last 5 to 6 years. Basically, when analog technology was replaced by computerized technology. And from our standpoint, it's allowed us to do implantations with materials that we haven't used before. You can have long-lasting hearing aids that go into the ear canal and can be left without having the batteries changed every week like a conventional hearing aid.
If you or someone you know suffers from one of these conditions, consider a visit to Central Plains ENT and Audiology. You can expect to receive a comprehensive evaluation from both experienced ENTs with specialty training and balance evaluations and highly qualified audiologists. Surgical and non-surgical treatments include implantable hearing devices, cochlear implants, and minimally invasive ear surgery. Nearly all of this and more can be done in their state-of-the-art surgical center just steps away from the office.
At a specialty hospital, there is less bureaucracy, less red tape, and lower costs for the patient, the patient's insurance company, and of course us.
And it really helps with everybody because the length of the surgery is shorter, the length of the recovery is shorter, there's less medical errors. Patient satisfaction goes way up.
Christina Harder is a patient here and explains how finding the facility helped improve her quality of life.
When they first turned on the cochlear, it was very loud, and they had to do some mappings on the actual cochlear and to make it more comfortable to my hearing level. Before, I steered away from talking on the phone because it was always hard. And now I can actually have meaningful conversations with my mom who lives in St. Louis. And we just talk for a whole hour with no problems whatsoever.
Their equation for success is simple. The latest diagnostic equipment and treatment options, coupled with experienced professionals with advanced training, results in the best outcomes for everyone who comes to Central Plains Ear, Nose, and Throat and Audiology Centers. With 4 locations covering 3 states, there's no reason to live without sound or balance. Visit us at our website, centralplainsent.com. To schedule an appointment today, call 402-502-6970.